The Francis S. Balassone Annual Lecture brings leaders and experts to the school to engage our faculty, our students, and our staff on important conversations. This year's lecture focuses on a topic that is very much at the center of our lives: COVID-19 vaccine hesitancy.
Hi, I'm Dina Tran. I'm an associate professor in the pharmacy practice department. And this year's Balassone lecture had two guest speakers. We had Ms. Joni Hollifield and Ms. Anita McNair, and they're both community activists in the West Baltimore area. They came in to speak about vaccine hesitancy, especially in the age of COVID. And we also showed a short documentary called The Vaccination from the Misinformation Virus. So I got inspired about having this documentary and having the community activists come in because I had actually heard about this particular documentary through AACP. It actually features a few pharmacists and actually a few people from West Baltimore, so that's actually kind of where my inspiration came from. And I also work on this HRSA grant, this $7.8 million grant, which I'm very honored to be part of that research project. And it's actually about reaching out to the community, helping community members learn more about the vaccine and increasing vaccination rates. So I thought that this was a great synergy to bring both of those things together.
My main message really is going to be from a community perspective, from a native West Baltimore perspective, explaining the hesitancy around vaccination. I think a lot of people are confused about some of the priorities and some of the other things that are happening in West Baltimore. And for some people, COVID just isn't the end-all be-all. So I really just want to provide some context around that and hopefully answer some questions and help people to be able to approach their jobs in a better way to where so they'll feel like they're making more impact.
So I work with mainly youth in the community who experience, any source of trauma. We focus on the trauma-informed care approach, focus on the youth strengths instead of their trauma. It's hard putting your trust in the healthcare system when you have been failed.
I think a lot of people just really don't understand the grave danger that COVID poses because we're so busy fighting all these other demons. So we really want to be able to talk to people in a way that they understand and really meet people where they are.
Build a relationship with the community, build a trusting one at that, and don't force it on people. When they're ready, they'll come to you and they have to make the decision on their own for their health.
A lot of my professional friends that I've met on this journey often feel intimidated having a conversation with people who are from the community or even going out into the community. And my main message is that if you're going to do work that benefits the community should be able to put a face to the information and to the things that are coming out. And it just helps to make the work better, and also having a real partner relationship with the community is going to benefit everybody on both sides. So I would say, let's get out there, put some boots on the ground, regardless of where you sit.